my name is Malik. Welcome back to the channel Malik Helps. Now we are going to talk about the rheumatoid arthritis and osteoarthritis. I don't want to go into the details. The aim of my channel is just to solve the Krok questions. So if you want detail, you can find the information over the Google. But here is the main key information to solve the Krok question and the keywords for the Krok question. So let's go. So first is rheumatoid arthritis. As you can see, rheumatoid arthritis basically means the chronic autoimmune disorders which will primarily affect the joint. No need to remember all of the symptoms. Simply remember that the joint space will reduce, and the main highlighting symptom for Krok is joint stiffness for the morning time. Morning stiffness is typical for rheumatoid arthritis. Let's go to the questions. The question says 60-year-old patient complains of the recurrent pain in the paroxysmal interphalangeal and wrist joint and the periodic swelling, reddening that have been observed for the 4 years. X-ray picture is also important for the Krok question. In X-ray, they will say osteoporosis and joint space narrowing, as I have told in the definition part. So they marked already a joint space narrowing and ussurus. So sometimes they say ussurus, sometimes they say ussurations, which simply means erosions. Erosions are the defects which are occurring in the bone due to the osteoporosis. So when you see joint space narrowing or some ussurations, mark rheumatoid arthritis. Let's go next. Next is an 8-year-old patient complains the pain in the knee for the last 9 months. Recently, noticed some limitation in the motion in the right leg, morning stiffness. That doesn't last till the evening. So the problem in the rheumatoid arthritis, as we all know, is morning stiffness. Since it occurred in a child, so we will mark juvenile rheumatoid arthritis. Next is another patient complains about body stiffness in the morning. So it's the same way, morning stiffness, which will disappear after 30 to 60 minutes later. The problem with the metapharyngeal joint, proximal phalangeal articulations, the osteoporosis, erosions I have marked like this. Defect will occur in the bone, which we known as erosion. So when we see morning stiffness, we mark rheumatoid arthritis. So next is another girl, a child have a fever, spindle shaped swelling of the interphalangeal joints, pain in the upper chest and neck, and again the morning stiffness, so mark juvenile rheumatoid arthritis. Another patient complains about the pain and edema in the small joint. Shortness of breath is not the typical symptom for RA, but the patient may have something else in the background. Weakness, fever, fine punctate hemorrhages on the torso and the limbs. Ulnar deviation. So ulnar deviation is also one of the characteristics of rheumatoid arthritis. In some more questions from the test center, I have seen this. They mark as ulnar deviation and give a profile for something else diagnosis. But whenever you see the ulnar deviation, never forget to mark rheumatoid arthritis. So you can read out this question, but the main key point is it involves the small joints and the ulnar deviation. Another question they asked about they give the profile for the rheumatoid arthritis, and so they ask about how to treat the patient. So the choice of treatment for such diseases like rheumatoid arthritis are DMARDs. So one of the choice of treatment for rheumatoid arthritis for the Krok is methotrexate. This is something which you have to mark in the Krok question. Next is osteoarthritis. Let's define it. Osteoarthritis is a joint disease which is characterized by the breakdown of cartilage leading to pain, stiffness, and reduction in the joint mobility. Although sometimes it looks similar to rheumatoid arthritis, but I'll tell you the differentiating points. So the stiffness which occurs is not typically like the morning stiffness. The main thing is like when it says morning stiffness, it is typical for rheumatoid arthritis, not for the osteoarthritis. So the main key feature which we are going to see in the Krok questions, it will be bone spurs. They are the direct highlighted keywords from the question straightforward. Osteophytes it will say, or bone spurs it will say. So they are the bony projections along the edges of the bone, and joint space narrowing is the character of both of them. Inflammation, this all occurs in both of them. So let's see some questions. After seeing some questions, you will understand what is the exact key point of both of them. So a 55-year-old complains in the pain and in the left knee joint occurs when she climbs the stairs. Joint becomes stuck. 5 years ago, she suffered from the trauma of the left knee. It's kind of history. CBC and biochemical analysis normal. The X-ray profile is most important here. The X-ray profile says osteosclerosis, so the joint space narrowing. Let's say hardening. I have written the meaning here. Hardening or increase in the bone density, so which will lead to the limitations in the movement. So osteosclerosis. Same way I have said, like osteophytes. These are the small projection bone spur, we call them. Like on the left and right of this photo, you can see 1 and 2. These projections are normal, but the third projection, which is getting on the bone in the middle, is something known as bone spur or osteophyte. So I hope you will remember this osteoarthritis. This is the key point. Next, let's go. In the next question, the patient says pain in the interphalangeal joints in the hand during work. So it occurs during the work. In rheumatoid arthritis, it starts to occur without working itself. So this pain occurs during work, when the person finally start to work. In rheumatoid arthritis, what happens is when the patient he wake up with the stiff joints. So as soon as he start moving his joints, the pain improves. There is no problem with the pain anymore after some 60 minutes. But in osteoarthritis, the problem occurs is when the patient start to work, so then the pain will occur. Hope you will find it important. So another important thing is Haberden nodules. I'll show you already. Haberden nodules looks like something this. They are the same way, some bony projection. Which is extra and not required in the bone, which will limitize the mobility of the joint. So X-ray shows narrowed joint space, osteophytes, subchondral sclerosis, the same way as now. I hope it is easy now. So Haberden nodules are given in the question. Never forget to mark the osteoarthritis, since the Haberden nodules are mentioned in the question, so it's nodular form. Let's move ahead. So the question says, the examiner wants to ask, like, if we know about the X-ray picture of the osteoarthritis. So a 55-year-old woman, deformed finger joints, pain in them during movements. When she start working, then it pains. If it would be rheumatoid arthritis, the pain would have disappeared with the activity. So there are some small bony formations on the lateral surface of the distal interphalangeal joint. How do we come to know that? Through the X-ray, that there are some extra bony formations, same as I have told you. Like consider it any joint. So the left and right are the part of the bone. The middle one is not the part of the bone. This is the extra projection getting developed. So slightly painful or palpation, the examiner directly asked that what are they called. So they are discovered by Haberden, so we call them Haberden nodules from osteoarthritis. Another thing is there, one is deforming osteoarthritis. So there is a construction worker, elderly construction worker, reports the pain in the right hip, knee joints, which will get worse on exertion. So the same way, when he start doing the activity, the pain get worse and worse. So the joint is deformed, organ revealed, no pathology. So this time we have to understand the question through the definition itself, or let's say through the key symptom, because the question didn't say anything about the osteoarthritis very well. But let's say osteoarthritis, I have wrote the definition again. It's a degenerative joint disease that commonly affects the older adults. So our patient is an older adult, and those with the history of joint overuse. He is a construction worker. The whole life he worked as a construction worker. It's a harsh job under the uncomfortable environment. So never forget to mark deforming osteoarthritis. This is it with this video. Hope you enjoyed the video. Subscribe to my channel, share these videos with your friends who are targeting for the Krok 2 preparation right now. Have a nice day. Wait for another video. Thank you.